Okay, hi, it's Dr. Buford. We're just getting started on your left shoulder. We're looking at from the back to the front. Everything you see is magnified 30 or 40 times on the screen. Here's this biceps tendon tear that's been causing some of your symptoms here. And like we talked about, we're going to reattach that into the bone. It's called a tenodesis, a bony tenodesis. And so we're going to go ahead and release the biceps here. Okay, you can see we're almost completely done. Okay, now the biceps is released. Now we're going to put in a shaver and just smooth out the remaining labrum here. But now that the biceps is no longer pulling on it, this won't continue to cause pain, hopefully. Trying to contour that, make sure it's not going to cause any problems here. I think we're just about done with that. Very good. So, okay, so let's look down the back. So here's the posterior aspect of the shoulder. The anatomy here looks pretty good. No signs of any real problems with the humeral head. You really do not have much arthritis, which is good. And then here, as we look down the front of the shoulder, the anatomy here looks pretty good as well. We'll rotate up and look at the rotator cuff. This is the rotator cuff at the top of the screen. And that looks, pull back a little bit. That looks very nice here. No signs of any significant problems with the rotator cuff. So we're just going to shave a little bit more of the superior labrum. Okay, so we're going to finish up here and have a look up above. Pause, please. Taking out the acromion, this is just taking off a little bit of the bone at the front of the shoulder. And we do this just so it doesn't pinch on the rotator cuff below. Just about done with that. Okay, so now we'll have one more look around and show you some more in just a minute. Jordan. Okay, so I just wanted to show you, we're looking at the rotator cuff from the top side. And so we'll start way in the front over here. We'll start way in the front here. And the cuff looks fine below. We'll slowly come back. And this is pretty much good news. Every place we can see, the rotator cuff tendon looks fine. So we're going to finish up on the arthroscopic portion of the case and get to work on fixing that biceps tendon, okay? Good luck.